just allowing us to have a last night's slumber and sleep and wake up on today. As we go through this day, we ask you that you would continue to bless us, to continue to pour out your spirit upon us, pour out your favor upon us, that we may be the sons and daughters that you have called us to be. Now anoint these brothers as they give the information that we need through these airways. God, I pray on today that you will anoint them for your service. In Jesus' name, amen. All right, my brothers and Michelle, brother, good morning to you.
Good morning.
Good morning.
Good morning, Colonel. How you doing? I'm sorry. Good morning, Bishop. How are you?
Man, I'm doing well. How about yourself?
I'm doing great, man. We glad to be back. Glad to hear your voice, and we can move forward with our new programming. But thanks a lot for what you do for us. We really appreciate it.
All right, man. You guys be blessed.
I hear you, and thanks for that prayer. So we'll get started. Every day we rise is a great day to be alive, and welcome to WGPL Joy 1350. The Seven Cities Forums of Hampton Roads presents the new Portsmouth Coffee Talk with, my name is James Slim Overton, and our other host, Leah Drake Stitt.
Good morning.
Thomas Chapman. Good morning, host. Fellow
Good
host.
morning. Good morning.
How are you?
Every day is a good day.
Yes, indeed. So we're so glad to be back on the air and going forward. We have some exciting things that happen, but and we'll talk about that next week. But today we have a very important topic we want to talk about, and we have some important special guests here that is going to help us with this topic about the COVID-19 and its effects on the city of Portsmouth and regionally in Hampton Roads. First, we have Dr. Lauren James-Vaughan, who is the director of the Portsmouth Health Department. Good morning, Dr. James-Vaughan.
Good morning, Mr. Overton. How are you?
Thank you for getting up early and coming here with us. Again, this is your second time on our radio show, and thank you. And also with her, we have Avanti Benson, who is the Population Health Manager with the Portsmouth Health Department. So thank you for getting up this morning, Avanti. How are you?
I'm doing well, and thank you again for the invitation. It's always a pleasure.
Yes, we appreciate you. And we'll get started because this is an important subject. We want to make sure we get as much within this half an hour on our radio show as possible. So if one of our hosts, Leah, if you want to kick it off or start off with a question or a comment for either one of our guests this morning.
Good morning, Avanti and Dr. James. It's such a pleasure to be on with the both of you this morning. You both hold a special place in my heart with your father, Avanti, and your parents, Dr. James. So welcome to Coffee Talk. My first question is, with the governor's new mandate, how is that impacting upon, I know a lot of people are still trying to go to these group exercise classes, these people are still trying to go to the gym. How does that impact upon those individuals trying to go to those places?
So
Well,
go ahead, Avanti.
The governor's mandate is what we go by, and pretty much that's the law. 10 people. And we always suggest if you can do anything outside is better.
Right.
Safe at home is the safest, but and we want to encourage physical activity. You need that physical activity. It helps you physically and mentally, but there is a limit of 10. Now, I do know personally, they had been doing a good job, some of them, of making sure that they're keeping the facilities clean, but it's 10 people. You always have the option of going out to the parks, and especially in Portsmouth. Portsmouth has several parks and open fields that are accessible to the community.
Okay.
It's a good point. I have a question for the groups or our experts. When the vaccine is ready, and you mentioned earlier before we went on air about our young folks, the kids that are out here 19 and the 20 to 30 age group that don't have private providers. How are we going to get the vaccine to them, to this underserved population?
That's a very good question. Just like COVID testing, there is no fee for the vaccine. A lot of the local health departments and hospital systems will be partnering to distribute the vaccine. I cannot speak for private practices, but I know the health departments will not be charging for the vaccine, and we will be targeting all age groups eventually. Although we do have in the beginning, we are prioritizing our healthcare workers because they are, our front line.
Where, Dr. James or Avanti, where are we on the list of receiving the vaccine? I know that it's already gone out to some states. So where are we as far as when will we receive the vaccines in this area?
So Virginia should be receiving vaccines hopefully this week. There is a process where FDA has to approve the emergency usage. And I think we are in that process now. And the vaccine companies are already packaging it. And it appears that as soon as we get that go, and it could have very well happened last night where I was sleeping. I apologize, I haven't checked my email. But the vaccine companies are ready to get us our shipments. We're optimistic it could be as soon as this week, but they are very, it's called Project Warp Speed. I truly believe they are moving at warp speed.
They are indeed.
While staying safe, while keeping us, safe, promoting a healthy way and a way to keep us safe.
Thank you.
Dr. James-Vaughan, speaking of numbers that we get, and we talked a little earlier about how they're compiled and how they're reported. I saw as of Sunday, it's like 3,294 cases in I guess that's Virginia. But it also mentioned that in Hampton Roads, Saturday, it was like 15% rise, and Sunday, it was up to 25%. And that's a big jump. They saying the jump very high, especially down here in the Hampton Roads area. Am I correct? Am I reading that correct? Or
are you looking at the VDH coronavirus site?
Well, not. I think that's where I got it from. I got it off a notification off that I get, and I think it was that site. Are those figures a little different from what you have?
Yeah, just a little bit, but what I would say, and there's so much information and data, what I would say to look at that's the most helpful is the 7-day average of cases. So in Portsmouth, over the past 7 days, our case average has been about 38 cases a day, as opposed to before Thanksgiving, we were at 12 to 15 cases a day. So we are seeing a surge across Hampton Roads, across Virginia. We are at high community burden transmission. That means it's highly prevalent in the community. And as of today, Portsmouth's percent positivity is 11%, and the state is 10.8%. And the percent positivity is just the amount of positive tests per our testing in the community. So that's a marker that we can look at. I don't think our incidence is just your prevalence of disease in the community. I don't think it's at 25% for the state. That would mean 1 in 4 people have COVID, but I'm not seeing that on my chart. But it just depends on what data you're looking at. It could be a different data marker, if that makes sense.
Right.
Yes, and that's why it's so important to have you on, because a lot of people see this information and it's coming from a lot of different places. And the main thing is to get the factual information. And one other question before the other hosts come on. The city of Portsmouth, with our numbers, as far, do you all compile maybe where those, the age groups that we have in the city of Portsmouth, as far as the cases and the deaths, is that compiled like that, or is it just raw numbers?
No, that's a really good question. So we have an awesome epi, and her team does compile it. When we last presented, I think to the school board, we gave that data, and I'm just trying to tell you when it was done. It was done in November, but the trend from May to November was the same. The largest amount of cases were in the ages of 20 to 29 and 30 to 39. And then the largest amount of deaths were age 65 and up.
And that large amount of deaths, was that primarily in nursing homes or?
So that's a good question, Mr. I think I can say across the state, our largest amount of cases and deaths are in nursing home. I'm not quite sure about Portsmouth. I can look into that, but we do know that the majority of our deaths are age 65 and up, and they are an African-American population.
With comorbidity. They have other cases going on in there.
Yes, ma'am. Other chronic disease.
Yes, yeah.
And it's also important for us as a public to keep up with the numbers throughout Hampton Roads, since we sort of interact so much with all the other cities. You have people coming and going through the cities. So it's good for us to keep up and know what's going on in the other cities. So, and have everybody in Hampton Roads adhere to what the governor is saying and what the health department is putting out there.
I agree.
Dr. James, you know what, I looked at the national plan, and the national plan being foggish, and looking at the state plan, you mentioned the public health system in the state of Virginia and here in Portsmouth and the Tri-Cities, is them being out there and going to distribute the vaccine. But I think when I look at the plan, there's the long pole in the tent, or the short pole is you having enough shooters out there. Actually, the providers have put the vaccine into people's arms. Mm-hmm. What are you doing to do that? And then that affects to get that population, that 20-year-old kid didn't have a provider out there, that's not going to CVS, that's not going to Walgreens or whatever. How are we going to get it into them? And they don't even know where the public health office is.
Very good. All very good points, Mr. Chapman. So the health department, we are actively seeking additional staff to serve as vaccinators. We are looking into partnerships. Virginia does have the Medical Reserve Corps, which is a group of volunteers. As of Friday, our health commissioner sent out a letter urging those who can to come join the forces. And actually, we've had people come out of retirement, which is awesome because, they work really hard and they do want to relax, but they just feel compelled to give back all across Hampton Roads. We've seen that, and we are just trying to get more and more staff so that we can have the biggest impact. And to your last point about reaching age groups, especially younger folks who don't typically need care. We know the people who go to the doctor the most are probably older African-American women.
Yeah.
And that's just because they're really good patients. No, well, all jokes aside, that has been reflected in studies. So you raise a valid point. How are we going to reach those harder to reach group, the younger people who are asymptomatic and don't feel they're affected? A lot of the local media campaigns have focused on that, although as a younger person, you may not be affected. Think about your parents, your grandparents, those in your community who are vulnerable. So we're trying to hit on that, the community emphasis, and we're just gonna have to get really creative because that is an important group that we cannot miss. And Avanti and I have a big job.
Yes.
And that's something that's in the works right now as well. I'm not able to give it out yet, but they're working with local celebrities to try to get the word out via text message, radio campaigns, because we know that particular demographics, they're not like us. They're not going to read the newspaper. They're not going to check the data. But to hear someone say, hey, man, okay, we need to physical distance. Think about your grandparents. And that's where it hits home. With the younger people, they may know, but they're not aware. But when you say the grandparents, that's when it hits home.
One other thing too is what is the data collection requirements that you have? Since we have to give 2 shots, and then so, for instance, we have a flu vaccine and you have the drive-through clinics, and it has a different data collection that since it's only a 1-shot flu vaccine, now that I have to give 2, now I've got to go back and make sure that this whoever's getting vaccinated, say in the clinics or whatever, they come back to get the second one. and to make sure that, yes, I reach those who just don't pay attention.
So we do have a new database that we're going to be using, and all the staff are going to get trained on it. What it does is it allows us to document the first vaccination. It allows us to create an appointment for the second one, so that we'll basically have a running list of those who need this second shot. And, you know, there is a window of when it should be received. So we're going to have to work really hard to get, you know, to inform those people when they get the initial shot, this is the second step, and it's very important. But also on the back end, contacting them for follow-up. But that, you know, it does present another challenge, but this has been a challenging year for everyone.
Yes.
So we're up for it, right?
Yes.
Ask your question, in light of that, you know, with the feeling in the public with some hesitancy about the medical profession, about the vaccine, about the COVID and what have you. What do you think about that app that they have on the phone? A lot of people are saying that they don't want to download the app because they feel as though it's some type of a tracing mechanism that's being used by the government. But what would you say about that COVID Fight download app that they have for the Apple phone, I guess for the Android phones as well? What are your thoughts?
I have the app on my phone, and because I work for the health department, I felt obligated. It's just like anything else. It sends, for instance, I've been driving, and if something goes off, it'll tell me, hey, you've been in contact. But I look at it as a mechanism. If I have been exposed, that's that sign for me to contact the health department.
And to be tested.
And to be tested, yes. That's important. You can't just ignore,
right?
If you have been, you have to take those precautions.
Mm-hmm.
You're obligated to take precautions.
And the more people that sign up for it, the more prevalent it will be that you'll be notified. Mm-hmm. So that's the back end of it. There is a fear, a distrust, but as more people, you know, get enrolled into the system, it becomes more effective.
Okay.
So definitely promoting it, and it's really just to, as Avanti said, just make you aware of someone around you is a case for your own, you know, wellness, and so you can take the next precautions.
And it's available in the App Store as well as in the Google Store. So
yes, I'm an Android, so
we would
I've had it.
We would encourage everyone to download this on your phone, and then we can get a better tracing as to what's taking place with this COVID-19.
Mm-hmm.
Yeah, that's with the contact tracing. And Doctor, I want to go here and wonder if you know, or the health department knows, how it's affecting the African American communities in the city of Portsmouth or surrounding cities.
As far as just COVID in general?
Yes.
So that's a very good question. And, you know, we have to start at the beginning of health disparities and how African Americans do have high chronic disease, a lot of barriers in addition to that. So that does make us more likely to get COVID and more likely to have fatalities. And that is from what I've reviewed. I haven't reviewed every city in Hampton Roads, but for the majority, we are those who are mostly impacted. And another layer of that is that if you look at jobs in Hampton Roads, a lot of African Americans are essential workers, and essential workers might be those who work in grocery stores, those who are bus drivers, those who are not medical frontline, but they are in constant contact with the community, construction workers. So that's the other layer. Not only do chronic disease predispose us to having worse of an outcome, we also have jobs that may put us in more of an interaction with the public. And then the other layer is we might have jobs that don't allow us to telework. We might have jobs that don't give us full benefits to have sick leave. So they may have to work while ill. And, you know, that is not what we're recommending. But some people are truly in a position where they have to choose, do I pay my rent or do I call in sick? So it's very layered.
It is.
And I think I see a question here on our Facebook, and I kind of know what your answer is going to be, but Mr. Keith Brown asked, do you think it's a good idea to take the shot? So I know as a doctor, coming from a doctor, I know what your answer is going to be, but it's a lot of layers to that as well, because you take a look at me, who is a heart organ transplant recipient. So we would have to look at that. And I don't know if someone like me was included in those original tests, you know, how does it affect a heart transplant patient or a kidney or a lung, you know, transplant patient? How is the vaccine mixed with the medications we take, or just having a foreign organ in your body? How does that work? So that's going to have to be further studied. But generally, that's what this gentleman is asking. And we know that most of the people in the African-American communities are a little leery because of the history of testing and what they're hearing about the history of the Tuskegee. And so I know you're going to suggest yes. It's right now in the beginning, it's prioritized anyway, you know, to get the essential workers or the healthcare workers and the elderly in the nursing home. So.
Right. So that's a very good question. And Mr. Overton, you basically answered it for me.
Yeah,
Thank you.
I asked the question and I answered it at the same time. Sorry about that.
So I do think we should all be educated based on our health status and, you know, special things we might have related to us. And we do have to remember that it's still very new, but I think you should educate yourself, work closely with your primary care doctor so that based on what we do know, we can move forward to see if it's a safe vaccine for that individual. But really staying educated and knowing that we are, you know, prioritizing the frontline workers and the elderly in nursing homes, because that has been where we've seen the most cases as of now. And we just will continue to learn more and share with the public everything that we learn so that we can all be informed and educated as we move forward in the vaccination process.
And Mr. Overton, may I add something? That's why the health department is so important in the community. We try to break down the barriers to educate our communities to make sure that we have that relationship so that we're the first line of defense. When there's a question, if they don't have a primary care physician, we're going to recommend that if they don't have insurance, that they sign up for the Affordable Care Act, where there are resources, linking them, giving them the best options for healthcare, living a healthy lifestyle, because we want to break down those barriers and the myths. I just attended a session on misinformation. There's a lot of misinformation that's sent out through the media, and you can't believe everything that you see or read on the internet. But if you come to the health department or call the health department, we have valid information, and we have lines set up. We actually, because of COVID, we have a COVID outreach worker, and her job is to specifically get the information, resources to community members who call and need assistance.
Okay, I have a question about young people. It has been said that young people, once they have contacted the virus, later on, there are other factors that come into play in their lives as far as their health is concerned. What is that all about? You know, like you may have had it during the summer, and then later on you manifest some other symptoms as a result of having had the COVID virus.
I'm not familiar with that. I do know that it's been studied that people, once you get it, you do have a brief period of immunity, but it's not thought to last very long, a few months. And I do know that in very young children, they can have, I don't know if this is what you're talking about. It's called MIS. It's an inflammatory reaction.
Yes.
They can present atypically. It may be a rash, a very serious rash, but that presentation is seen in the pediatric community. But that's another thing. That's why we're so lucky to have the Children's Hospital locally, because they are really on it, and the cases that have gone there have really had good outcomes. And this new emerging virus, they've still been able to handle it. But that is a wonderful resource to our community. I haven't read exactly why it presents so atypically in children, but we're still learning a lot about it.
But no impact upon the organs, the heart, lungs, or?
I'm not sure, I'm sorry.
Okay.
Yeah, I think Leah was talking about what they're calling the long haulers.
Yes.
Those who had the fog of night and 3-4 months down the line after they've recovered. But I will get to another point though, is that one, across this nation, I know the public health system has been underfunded and under-resourced across this nation, especially even in our communities. So what is your prediction, and when will the average man or woman on the street be able to get the vaccine? And because if you look at the numbers that were projected, just the numbers of vaccines that the hospitals have gotten across this country that I've known is not enough even to the healthcare workers. So when am I going to get my shot? And that's one. And then J&J will have theirs, which is going to be coming out in January, February time. It will require only one shot, and I believe what I see in some of the studies, you'll have higher titers than the first two, the Moderna.
Yeah.
Yes, and then so by that time, will I have a choice?
Mm-hmm. Oh,
and I preface that by saying I'm one of those retired healthcare workers out there too.
So, are you volunteering with the Medical Reserve Corps?
I got the email from the from the folks up from Richmond already.
Great.
By the way, Doctor, the colonel is retired colonel out of the military army, the nursing corps. So if he sounds like
we know where to find you.
Yeah. For your service, Mr. Chapman. But both very good questions. To answer your first question, I think the vaccine, optimistically, just a prediction, as we said, this spring. And I like the way you already alluded to the competition. So just like the flu shot, now you can get it everywhere. My hope is that eventually COVID will have more and more of these awesome vaccine companies, pharmaceutical companies adding on, improving it, just really building out our infrastructure and our bandwidth to offer more. So that's what we're hoping. If anything else, the United States is known for an open market. So I do think our pharmaceutical companies are all trying to get involved and have a, for lack of better words, have a more competitive vaccine than the next one. So I do think from that end, we will be able to provide people who wish to have the vaccine with that. And with options, that's the biggest thing, because a 2-part vaccine might not work for everybody. As far as like their convenience. They might prefer one shot.
And then for some of those folks I've been hearing saying, well, I'm going to wait 6 months to a year to see what happened to those folks in England who took that first shot before I make a decision as to whether I'm going to take that shot. So if it's going to be that far out, then whatever's going to manifest may have manifested by then, and they can see that it's okay to take the vaccine.
That's a good point.
Yeah, I think what a lot is going to happen when they're going into the nursing homes, that's going to be a priority. And that's one place where some of the people in there probably have some of everything. So whatever information can come out of that, and hopefully it's not like a guinea pig situation, but it's going to be something that's going to benefit the future recipients of the vaccine, because those people have some of everything, and hopefully it'll be more of a positive outcome.
Right, yeah, and definitely not a guinea pig. I would say more so focusing on the most vulnerable, because if you look at I'm sorry, the statistics across the state, I think it's about 40, maybe 44% of the cases are associated with nursing homes.
Exactly.
So it's really looking at the data and trying to put the resources where the need is. And I think this is one of the times where we're showing that our elderly, we still value and care about them. I don't know if all of our practices and policies really reflect that sometimes. Mr. Overton knows I used to work in primary care, and just to see my older patients who'd worked so hard struggle to afford their medications or struggle to transition into a nursing home or get care in the home. So I think this is the opportunity for us to, provide that to a vulnerable population that we should be taking really good care of traditionally.
Good.
Yeah, I didn't mean to use that unscientific word, but
I know what you mean, though.
Yeah, it's been thrown out there by a lot of people, so I just wanted to sort of take that out of the conversation and make sure people, like you explained so well, that this is going to be something that's going to help. And the vaccine will be free to all those that are given. The government pretty much has already paid for it, or, because I guess that's an issue too. But we've heard that, but that's a fact, if I'm correct, right?
Yeah, to my knowledge, we've been told it cannot be charged for. So, in private practice, it's a little bit different. I don't think they can charge for the actual vaccine at this point. I think it's more like an office fee or administration charge, but I would not be deterred by that because our health commissioner, public health, they're all really still advocating for people to get this shot, this vaccine, with as little or few barriers as possible. So I would not, let that be a deterrent.
Yeah, just like those flu.
But that still is a barrier to some. That still is a barrier to some. That office fee, and that's why it's going to stop a lot of people from getting it. But I have one last question, and this might be for the geneticists that are on this panel. So the Moderna and the Pfizer vaccine is using RNA as the backbone to make their vaccine. What is the chances of that kind of vaccine, when it's injected us, changing our future populations down the road?
Yeah.
That's
a tough question there, Colonel.
I don't know what
my degree is in English and mass communications.
Yeah.
Colonel has taken us to a new level here.
Yeah.
I said it's a laughing matter. It's a very good question. I would think, I don't know of any medication that changes your RNA for the future. So to my knowledge, the vaccines are basically fooling your system to think you already have it and creating a resistance. So I would think that just like the flu, these are short-term things. These aren't things that live in your system forever. So I wouldn't think they'd be permanent enough to truly change your genetic code.
Right. Yeah.
So once again, that's an amateur response.
Yes, that's why I preface my question as the geneticist is on the panel here, because we do in for oncology, we do different genetic tests and for markers and things like that, so we can tailor the medicines that we're given to those, so we can affect that type of cancer. And so that'd be a question for those who really read up on for this new vaccine and have their question on saying, well, you're gonna change my genes, and so 3 generations down the line is my son or daughter is gonna have 3 feet or whatever,
Well, I mean, I'm laughing,
that might be part of the educational process that we need to talk about also when we go out to the public. It does not change, right? It's not going to change me. I'm not going to turn green.
Yeah, well, the Colonel is sending us all back to school. But while I'm on here, we're going to go over just a few more minutes and with Facebook Live and Zoom. But we're at the hour where we have to close down the radio portion of our program. And we'd like to thank all the listeners on WGPL 1350 for listening to the new Portsmouth Coffee Talk with our hosts, Leah Drake Stitt, Thomas the Colonel Chapman, and yours truly, James Slim Overton, and plus our guests. We had this morning Dr. Lauren James-Vaughan and Avanti Allen Benson. We really appreciate you. But stay tuned. The people that are on Facebook and Zoom, hold on. We're going to go over a few minutes if the guests will allow us to, and wrap up and finish up our conversation. But those on the radio program, stay tuned for next week. And we'll be back with our new program. And as always, be aware, be informed, and be involved. Thank you. And thank you, Bishop. So we're going to continue on with the questioning, and Bishop will come on and sign us off the radio, but we'll continue on. Leah, do you have another question or comment for our guest?
No, I'm just thankful for the information. I'm thankful for Dr. I'm going to say James, but Lauren, and also for Avanti. I'm thankful for the information that you've given, because it's truly information that we need in the public, because you do have a lot of naysayers. You do have a lot of people who still feel that they don't need to wear masks. Have a lot of people who don't see the need in all the hand washing and the social distancing. So it's very important that we get this information out to the community so that we can forego so many deaths and so much illness within our community. So I'm thankful to each of you for the information shared. And I'm sure this information that we are going to need to follow up on many times to come. So I'm thankful for you for getting up so early this morning to be a part of Coffee Talk with us today. Thank you so very much.
Thank you.
Yeah, thank you all for inviting us. This is a wonderful forum, and we appreciate your continued engagement to keep the community we care about so much informed.
Yes. And I'm going to use this COVID pandemic as an opportunity for us to continue to make our community healthier. When we have programs, in the past, we would have to beg people to come. We try to have our programs in the community to break down the barriers. So you don't have to come to us. We're going to come to you, but we need you to come.
Exactly.
We need you to listen and make those lifestyle changes. I've noticed food insecurities. There's a lot of food that's being given out, and I'm pleased that a lot of that food is healthy.
Exactly.
We need people to continue to make the lifestyle changes, eating healthy, physical activity. I've never seen so many people walking before in my life, riding bicycles. We need to continue with these patterns, staying safe and bringing down those comorbidities so that the next pandemic, we're going to be the ones who are succeeding. So I just want us to continue to go to the doctor, get your screenings, eat healthy, physical activity, in addition to wearing your mask, hand washing, and physical distancing. And if there's any assistance that we can give at the health department, feel free to give us a call.
And you know, and one thing I want to mention, Avanti, while you're talking, Avanti and I serve on the Title I
Healthy Starts
board service with
advisory board.
Title I group, working with parents of the children who are in the Portsmouth Public Schools, and all of our schools now are under the Title I. So, but Avanti can share, it would be a perfect avenue, Avanti, to share information with the parents of these students about the COVID-19. So maybe you want to say a little something about Title I?
Yes, with the Title I program, as Ms. stated, all of the schools in Portsmouth are Title I. Each school has a parent liaison. And I'm very impressed when there were activities prior to COVID, there was a great response. I'd never seen so many parents and students out for physical education night, math night, health and wellness night. They take this very seriously. Now with COVID, the liaisons reach out and I send them information. We've participated in drive-by events. There was a book night, and it just so happened that we had physical activity books that we were able to give, along with information on mask wearing. We were able to put in a mask for the students, healthy cooking demonstrations, a healthy recipe. So we try to give as much information as possible, not just in regards to resources for the health department, but resources to help to make your life easier.
Thank you.
Mm-hmm. And I'm ready to go back.
I am also, Avanti, I am.
It's unfortunate, but I guess fortunate in some ways that things like this come up that make people more health conscious. And I guess some of the things that came up when this virus came out, that building up your immune system to help you fight things like this that come up. Because after this is over, it could be something else that comes up. So
Right.
just like Avanti said, you see more people walking, riding bikes, and being aware, or going to their doctor, making sure you're keeping those appointments and making sure you're staying on top of it. And that's why I'm glad we had this program today. Colonel, is any other comments from you?
Yeah, I got a couple, and it's not going to be on the line of genetics this time. But thank you for coming on, waking up this early and giving out all this information. You know, it's been an eye opener, and I think this whole virus and what we've been battling it through for the last 9 months or so has been an eye opener for America, and it's taught America about the injustices of not just in race, but all across our nation. And it's opened up a wound that hopefully we will take some solace that maybe one day that we can have a more perfect union. But I mentioned the J&J Johnson & Johnson vaccine that's coming out. And I'm also concerned on how we're going to get needles in the arms of our population later on this summer, you know, probably in the March timeframe, and I'm looking at March, April timeframe. And looking at, have you, Dr. James and Avita, looked at saying, partnering with our local nursing schools to have use those folks as I call shooters that can, you know, put the vaccine in your truck, run it down to Cavalier Manor, and we have a vaccine drive-through kind of thing there for those who can't pay that copay, that doesn't have a provider down there is charging me $40 to go down there. I think that's going to stop a lot of people from getting this free vaccine, because I don't have a lot of faith in our providers out here that running the independent practices. They're going to try to make a little bit of money, and that's what I got to say. Okay, what say you?
So we are definitely looking into we're definitely looking into additional community partnerships so that we can get as many vaccinators as possible. But we also have to remember, especially with VDH, there is a stringent process that people must go through a training, if you will, to vaccinate, because we don't want to get on the other side of it where we've just given everybody the vaccine and allowed them to vaccinate on their own. So, you know, eventually medical practices will be able to get their own supply, and they are trained, but we do have to make sure that anyone under the public health umbrella has has participated in our training and been approved to give it for safety first. But we are trying to get creative and reach hard to compel populations. So that is a good point, but we hope that people are doing the right thing, and we do want to make it as accessible as possible. But we are trying to, you know, have non-traditional approaches as well.
Dr. Lauren, Dr. James-Vaughan, well, first, let me give a shout out to Antoinette Chapman, who is watching, who is the wife of the Colonel. She's a nurse practitioner, and she's been throwing some questions up here, and I'll get to one of those. But Dr. James-Vaughan, you know, what would you tell the public that is watching now, since it's already been proving that the Thanksgiving holiday proved to be a spreader of the virus, with families, really passionate about seeing their families and everything like that, and having the large gatherings, and we saw the spike. So going into the Christmas holidays, what would you say to those people that have that same attitude as far as wanting to come together? What kind of advice would you do? How would they sort of regulate that a little more carefully than they did during the Thanksgiving holidays, where we saw a spike?
That's a very good point. So what we worry about is we have a few factors against us. Flu season is upon us. It's colder. People are indoors more. And what also we've seen that we think contributes to the spike is that different age groups are mixing. So people of maybe like 60 to 70 and 20s to 30s who might not meet together often over the holidays, they do group and gather. So we do have to continue to practice safe holiday practices, such as just celebrating with those who are already in your home, because that does keep you at a lower risk. Or if you do have elderly loved ones, if possible, an outdoor celebration, or making sure that if they do come over, no one has attended that is ill. And also you have to think about, especially with younger people who may be asymptomatic, if they have someone positive in their home and they feel great and have no symptoms, that does not mean that they aren't also positive. A lot of people assume like, oh, well, I don't have it, but someone in my home does, but I'm okay. But when you're in that home, that's a closed area, so it's high risk that you can get it as well. But just being mindful of those things, because most likely if we continue on this spectrum, on this trajectory, there will be a surge over Christmas as well, unless the practices change. And that is why our governor and health commissioner work very closely to update the executive orders, and that is a form of mitigation to encourage safe practices among our citizens.
And one other question before we let you go. I think a lot of people say in a situation where it's 2 people or 3 people in the household, and one gets tested and comes out positive, and do the other 2 or the other 1, can they feel comfortable that they are positive? I mean, not the other one test negative, but the other 2 that haven't been tested can they feel pretty comfortable that they are okay if that one person that's in close proximity most of the time, or should they also get tested just to be sure?
Very good question, and it's a few layers to that. So if you are in a home where you all share a kitchen, a bathroom, everything, then you should consider that you probably all are positive, especially if someone is a caregiver, and that goes both ways. So Mr. Overton, with your daughter and her small child, she probably, because she's in such close contact, I'm not going to say but that would be an example of, that would be very hard to not be transmitted. But if someone, because I know there are some homes like this, if they have their separate entrance, their separate kitchen, their separate restrooms, that's a little bit different. But really in a true household where you're using the same facilities and someone is a caregiver, and that could be also caring for an older parent, I would say best practice is to consider that most likely they all are contacts, all are positive. And if they, want confirmation, they could get tested, but usually would ask them to isolate and quarantine together unless they truly have that differentiation in the home where they use their own facilities.
Thank you for answering that question, because, and some people might say, well, we've been over that a lot, but some things you can't say enough.
Exactly.
If one person, you haven't gotten the message out completely. So Some of these things need to be said over and over and over again, so we'll catch that one group that might have missed the message or misinformed. The main thing, and the main thing for this program, to make sure we catch people that might have missed something in the messaging that's been out there over the last 10 months. Because evidently some people are missing something, or we wouldn't be seeing these spikes that we do. It's probably missing the message, or people just tired of sitting home. But anyway, we won't hold you longer. We know you have a busy day starting off the week, first at your home. Then once you get out there into the world. But we are in this, and Denny, my host, fellow host, would like to make one more comment, or if the guest would like to make a closing statement, this is the time to do it, and we'll close out our program for this Monday.
Well, James, I'm hoping that with us having gone Facebook Live, and we're going to post the Zoom as well, that if there's anyone who has additional questions or concerns, that they will contact us and let us know what those concerns are, and we in turn can contact Dr. James and Avanti and get some answers for them beyond this programming here now. But one thing this programming has shown me is that the old adage is true, that the happiest people don't have the best of everything. They just make the best of everything. And we're finding a lot of people are being creative during this pandemic season. They're finding their true selves, you know, learning to do things a different way and making the best out of a bad situation. So that has been a blessing in some terms. So, but I'm just once again thankful to each of you for being here this morning and sharing this valuable information. And as I stated once before, and will not begin to state enough, I'm sure there will be many, many more times that we're going to have to ask you all to please give up your morning for us as this pandemic continues on, so that we can keep the public aware of what's taking place, what they need to do, and how we can all be safe and stop a lot of the problems that are taking place as far as death and advancement of the illness. But once again, I just want to say thank you all so very much. I appreciate you, all of you, even the co-hosts. I appreciate you as well.
Yes, indeed. Thank you, Liv. As we know, this is your inaugural time as a co-host to the new
And don't
format.
forget to mention Coffee Talk. We will have our mugs.
And the Coffee Talk, we want everybody to mention, I forgot to do it at the end of the radio station, but next week, each program we're going to mention something, and as we start the new year, we're going to ask our listeners, watchers, the question that we put out there, and we want you to answer, and you get a chance to win something. Really. And the question would be today was, who was our guest today? Okay, so write it down. So there'll be 3 more shows with 3 more questions, or 3 more questions we'll have out there. And then next year, we'll put the question out there for a person to answer all 3 of those questions. But and we'll get it on the radio next time. But Colonel, if you want to end, and because we want to let these people go, these busy people go.
I have one other thing to say, Mr. Overton. I'm sorry.
Please,
we're talking about the Portsmouth Health Department, but I failed to give you the contact information for the Portsmouth Health Department. If any of your listeners have any questions, feel free to call us at 757-393-8585. And you can go through the different prompts if you need assistance from the clinic, if you have COVID questions, WIC, any of those resources you're able to call. And also the Virginia Department of Health website, vdh.gov. It has a plethora of information from testing locations, because there are testing locations in other cities as well. COVID facts and figures, the data that we use is on that website as well.
Thank you very much. That's very important.
And thank you for having us.
Thank you for coming. And the information that you gave is very important for people to know, in order to know where the help is in the health department.
Well, I will be reaching out to the Colonel later on as well.
Put them to work, Avanti. Put them to work.
got to mention
It's fun
too,
work.
Yeah.
We can't do it alone. And I like to thank our community partners that we work with throughout this pandemic. For instance, our testing events are, along with Tidewater Community College, the faith-based organizations in Portsmouth. One phone call was made, would you allow us to do a testing event at your facility? They've said yes. There's no one that we've asked for assistance that has said no. So, and they say it takes a village, it does take a village. We've had a lot of community partners that have assisted us. We've tried to be as helpful as possible to the community. So thank you again.
Dr. Baum, would you like to mention you have a testing coming up Thursday at TCC?
Thank you for remembering, Mr. Overton. So yes, Thursday, December 17th at TCC from 10 to 1 while supplies last. Please come out. You do not have to pre-register. Just come with a valid ID. And that's just so we can know where to send your testing. That's just so we can know where to send your testing results. And also, I know we're all tired of COVID. Nobody is more tired than Avanti and I, but it is serious and we have to keep up the work, and it's a community effort. So even though you yourself might not be in the vulnerable group, you have to think about those you care about who are in that group. And once again, thank you for having us on Coffee Talk. It's been a pleasure. And I think this will be a great help for us to continue to inform our wonderful citizens.
Well, thank you again, and hopefully we'll have you back as the year goes on to give us updates on how this thing how the vaccine distribution is going, and how the numbers are going, and what the health department is doing. And
yes, sir.
We really appreciate you coming on and getting up.
So James, once again, mention Coffee Talk, the time and the station.
Yes, and we are in, and we want each one of our hosts to do their part. And I'll start with the Portsmouth Coffee Talk. Our voice.
Our community.
And I got a brain cramp.
Future.
In our future.
Our future. Yeah. Thank you very much. It's okay, Colonel. It's early. It's early. Can we try that one more time, James, please?
And thank you for watching Portsmouth Coffee Talk. Our voice.
Our community.
Our future.
Thank you.
Wow, we got it right that time. And of course, this is our beginning. And thank you again, our guests, and feel free to log off now, and we'll be doing that soon. Thank you, new hosts, and I think everything went well, getting our message out on the radio, and we didn't have any big issues, but things will get better as we go along. And yes, please join us next week as we continue with our program as the Seven Cities Forum of Hampton Roads presents the Portsmouth Coffee Talk. Thank you, everybody.
Thank you.
Have a great day.
Have a great day. Stay safe and be responsible.
Now all I have to do now is figure out how to log off.